There have been some changes due to the pandemic, and there's also some new legislation to consider for next year. Joining us now with some advice is Jason Resendez. He's a board member of Consumers for Quality Care. Jason, thanks for being with us.
Thanks so much for having me.
Let's start with COVID's impact on health insurance and what you think people need to know.
Yeah, well, right now there are a lot of changes that are taking place, which are important to keep in mind during the open enrollment period, which started November 1st and will go through January 15th. And so one of the top things to keep in mind are these changes that are happening to COVID-19 coverage. As you know, we're still in the midst of a COVID pandemic, yet we're seeing many insurers start to roll back coverage for COVID-19 related healthcare services. So while a year ago, if you find yourself in the hospital, unfortunately, due to COVID, it was likely that your hospital stay fees would be waived, and that's no longer the case. In fact, we're seeing 72% of insurers in every state in the District of Columbia start to roll back coverage. So it's important to know whether or not that coverage is being rolled back for your plan. So make sure you call your plan if you're in a high-risk situation for COVID to understand what those coverage options look like for you. We're also seeing a scaling back of telehealth services. This has been one of the silver linings of the pandemic, is increased access to healthcare through telehealth. Consumers have become really reliant on telehealth. In fact, we did a survey that found that 70% of consumers said they want to continue to use telehealth even beyond the pandemic ending, but we're seeing a scaling back of coverage of those services. So again, a year ago, you could possibly receive telehealth free of a copay. We're seeing those copays be reintroduced. So it's important to understand whether or not those changes are affecting you and your family's ability to access care.
So you have to really make sure you're reading the fine print during this open enrollment and do your research is always so important. You said one of the things that people need to be aware of is what you call junk plans. Explain to me what that means and what we need to know about them.
Sure. This is another thing to look out for during this period of November 1st to January 15th are short-term limited duration insurance plans. That's a long word, but we call them junk plans. These are plans that look great on paper because they have low monthly premiums, but they often come with high deductibles and exclude pre-existing conditions, including things like pregnancy, hypertension, and other common chronic conditions. So it's really important to look out for plans that have the term short-term in them and read the fine print, because while they look good on paper, you might access healthcare services and end up getting a big bill because those services possibly were not covered by that short-term junk plan.
I want to jump back to COVID real quickly, just because we've heard of some companies that have said to their employees, if you don't get vaccinated, we're going to increase your premium. Are you seeing that as a trend?
Yeah, we're seeing a lot of changes related to COVID-19 coverage and really looking to go back to normal in terms of being able to squeeze out of consumers as much as folks can from a profit perspective. So it really comes down to protecting yourself, doing what you can to protect yourself, but then also knowing what coverage you have in the case of infection.
All right, Jason Resendez, we appreciate your time. Board member with Consumers for Quality Care. A lot to keep track of. We appreciate your time.
Thanks so much.
All right.
Next for us, Matt Nagy returns to Bears